Good morning to some of you across the country. We welcome you to the Learning Collaborative for the mentoring programs that we support from historically Black colleges and universities and schools of nursing from Hispanic serving institutions and American Indian Alaska Native serving institutions. And today we are honored to have three presenters, Drs. Deborah Barksdale, Audrey Snyder, and Wanda Williams, on the topic of funding your nursing programs. Funding and fundraising is one of the topics that is consistently identified as one of the major needs by all three sets of schools of nursing that we support in your endeavors. And so therefore, we wanted to have this Learning Collaborative with all of you together. And of course, it is also leading up to the 2-day workshop we will have with you in September. And Dr. Barksdale, I don't know if she volunteered or I voluntold, or there was a combination of the two, but Dr. Barksdale not only is a successful grant writer for HRSA programs, she has also been a reviewer. And so she brings with her the insights and knowledge that she has of what are HRSA reviewers looking for in their grant applications. And so with that, I will turn this over to Dean Barksdale, and she will further introduce her two colleagues. And so take it away, Deborah, and thank you so much.
Thank you, Wynn, and thanks everyone for joining us here today. What we thought we would do today is to talk specifically about writing HRSA grants and some of the successes that we have had. I am the dean at UNC Greensboro, and I have two colleagues with me who will also be speaking to you today, and they have most recently been funded by many HRSA grants, as you will hear. And so we wanted to be able to share you some of the tips. I won't call it tricks, but some of the things that you might need to do to be successful with securing your HRSA funding. Now, we know that we do have colleagues from HRSA that participate in this initiative with AARP, and they're going to tell you more the technical side, and we're going to give you the insider view. So I'd like to introduce my colleague, Audrey Snyder. Audrey is fabulous, but she's a professor and she's our associate dean for community engagement and academic partnerships. And she's a nurse practitioner many times over and has done many interesting things here at UNCG, which you will hear about. And next is Dr. Wanda Williams, and she is a program director and interim department chair, soon to be department chair here at UNCG. And she was funded with a HRSA grant this past year, July, I believe. So she'll talk to you about some things you need to consider from her perspective. Now, a little bit about UNCG. We are part of the UNC system. We are classified as a minority serving institution, and that means that we're not an HBCU, we're not a Hispanic serving yet, although we are classified as emerging Hispanic serving institution. But we have a lot of diversity. In fact, we're the most diverse school in the UNC system. We're classified as a R2, high research productivity. We're not an academic health science center, as I know some of you might fall into that category as well. So even though we're not an academic health science center, we have still been able to be successful. We have approximately 750 students, and we have all the programs that you might imagine, the pre-licensure BSN, RN to BSN, MSN, DNP, PhD, and soon we hope to have the pre-licensure MSN. So our goals for today are to share opportunities for HRSA grant funding with you, and to describe some of our specific funding mechanisms here at UNCG, such as our LEAD grant for maternal child health, the Minerva Mobile Health, the SET grant, which is another one of Dr. Snyder's babies that deals with simulation, and the new, which is advanced practice. And again, like I said, we'll talk about some of the tips for writing these grants, discuss some of the common elements that you might find in the grants. So with that said, I'm going to turn this slide over to Dr. Snyder. I apologize, it's not as clear as it could be, but she's going to walk you through this slide to discuss some of the funding mechanisms.
Well, thank you for the opportunity to be here today and for us to share a little bit about our experiences. When you think about HRSA funding for your grants, really their programs are focused on mostly health workforce training. And how do we get more nurses or other healthcare providers into the field? And you can see from this slide that there's an area which is pipeline, which is what funds the Area Health Education Center, Centers of Excellence, some of the national academies. There's medicine, and that's where the primary care training and enhancement program comes in on the far right of the slide. There's also oral health, which is the lower left slide, and there's training programs, some that even focus on nurse practitioners being able to do some aspects of oral health. And so that's an area that you can look for, which traditionally I don't think nursing looks for their calls. And then under behavioral health in the lower right, there's the behavioral health workforce education and training, which does provide funding for psych mental health. There's the graduate psychology education and the opioid workforce expansion program that's there. And it may be that you have something within your school where that you could seek opportunities for funding in that area. Under nursing, there's 5 different areas that HRSA puts out specific different calls for. There's the advanced nursing education, nurse practitioner residency program, which frequently will be done between an academic institution and a school of nursing. There's NEPQR, the Nurse Education Practice Quality and Retention, which one of our programs falls into this area. There's also the Advanced Nursing Education Workforce, which Dr. Williams is funded under that area. There's Advanced Nursing Education Sexual Assault Nurse Examiners, and then the Nursing Workforce Diversity, which 2 of our grants fall in this area. So just to give you an idea, there's a very broad, large perspective there.
So the moral of the story is, don't just limit yourself to looking at the funding that's specifically under nursing. There may be other opportunities that aren't necessarily listed under the nursing funding that you might be eligible for. So we wanted to share some of the HRSA grants that are currently funded here at UNCG, and you can see we have a number of health workforce grants. Everything from the nurse faculty loan program, if you have a DNP or a PhD program, that's a loan forgiveness program. And so if you have those kinds of programs, you might want to look at that. Dr. Williams is going to talk to you about ANEW, which is Advanced Nursing Education Workforce for Advanced Practice. There's also scholarships for disadvantaged students. These are usually institutional level grants, but they are available, and we have that here at UNCG. We have a nurse anesthetist program, so we have a traineeship for that. The NEPQR, or something like that, that we usually call it, simulation grants, a nurse-led mobile health, maternal child health, and all of these grants provide student scholarship support. So I think that's the important thing. You're getting support for your students. In addition, I just want to share with you that we're not always successful, but we don't give up. So we submitted 2 grants last year that were not funded. One had to do with simulation, and another one had to do with LPN to BSN education. Back to you, Dr. Snyder.
Thank you. So I'm going to share about a couple of our grants. This one was really creative, and this is Lead in Maternal Child Health, Leadership, Education, and Diversity. This is not under the nursing call. So this actually is in the public health arena. I did write this proposal, but currently Dr. Lisa Anders, one of our faculty in maternal child health, is the PI on this grant, and I am helping to mentor and support her. Next slide, please. The purpose of this program is to try and develop a diverse public health workforce. And the goal is to recruit undergraduate students that come from a background that may be underserved or underrepresented, and to recruit them into public health and maternal child health related health professions. And this is all focused on trying to reduce those health disparities. The idea that someone could have a person who looks like them taking care of them. And we all know the maternal mortality that is out there associated with being a person of color, the higher rates that are present, and to increase healthcare access for vulnerable and underserved populations. So we are increasing diversity of the workforce through this project. We have 10 maternal child health scholars a year. Our goal is to recruit them from diverse backgrounds. And when HRSA talks about underserved or underrepresented, some things that fall into place there is the zip code of where a prospective student may have grown up, and utilizing that zip code to evaluate if that is a healthcare professional shortage area. Is it a medically underserved community? Do they have a high school that they graduated from that has a lower percentage of persons that are going on to college? And with this program, we've been able to do a lot of high school enrichment. The last 2 years, we've brought in students from area campuses onto area high schools onto our campus and help them experience simulation with our students, have a panel where our maternal child health scholars listen to them. And enhanced curriculum is also a piece of this. And we've had our students be able to become doulas as well as a part of this program. They have enhanced shadowing and internship experience, and so far 100% of our graduates that are maternal child health scholars have been able to secure a position in a maternal child health arena upon graduation. So great success there. We do know that if you look at baccalaureate programs from AACN's data, that you can see that a large percentage still in nursing is white. And our goal is to increase the persons of color who are going into nursing. We also know that in higher education, students from high income backgrounds are represented disproportionately by an excess of 45 percentage points. So with this grant, HRSA is hoping to actually increase the number of people who are from diverse backgrounds caring for our diverse population that we work with. The next grant that we have had funded is an NEPQR grant. And this is the first proposal that I have written for HRSA that gave me the goals or objectives in advance. And what I had to write to was specifically to these goals. And I find that many times what people have challenges with is actually just getting their objectives written for their grant. But HRSA gave them to us. We had to be able to establish or expand nurse-led mobile units, so we established. We had to expand the nursing workforce. We had to provide didactic nursing education, foster a community-based learning environment, which goes along with the essentials, and increase the diversity of the nursing workforce. So with our nurse-led mobile health units improving health outcomes with data science, we use the data science piece to be the innovation in our grant. And I would encourage you, anytime you're looking at writing a grant, is to, yes, follow all the rules, follow all their goals if they present them to you, but to actually find some way to make this be innovative. And we are actually using data science to pull from the electronic health record and publicly available data, creating a health index for the 5 most common disease processes in the Piedmont Triad of North Carolina, and utilizing that data to determine down to the census block level the areas of greatest need or higher health index that is negative for the persons in those communities. Then we try to partner with those communities to bring healthcare into those communities from a mobile health perspective. And this is a partnership that we are doing with Cone Health, one of our regional healthcare facilities here. And with them, they are providing the data scientist that is helping us mine the electronic health record. So part of the grant does support operations within Cone Health. We are one of 21 recipients in the United States. We have 3.7 million over a 4-year period. We have graduate and undergraduate nursing students who are placed year-round within our communities. We have increased access via mobile health with a mobile unit, by telehealth and rural clinics. We started out with a 6-county region funded under the grant, and we've expanded to 2 more counties this semester. Our objective is practice-ready nurses and increasing healthcare access in underserved and rural communities. The other piece is moving our clinical training from that inpatient, really acute care focus to more of an outpatient, ambulatory, at home, and meeting persons where they are, where they live, they work, and they play in the community. So this opportunity let us enhance the nurse-led mobile health unit service, both with Cone Health and the new unit that we started. We also enhanced our curriculum through a review focusing really on social determinants of health and health outcomes. And our goal is to produce graduate-ready nurses and nurse practitioners who can address the needs of the targeted population in the rural and under-resourced areas. This really does move us closer to the New Essentials goals. During this academic year, all of our seniors, all of our juniors, and 16 of our adult GERO primary care nurse practitioner students have participated in mobile health rotations. We've provided care in 8 counties, and in the first 8 months of operations, we cared for over 900 patients in our communities. We've been able to also support Cone Health's congregational nurse program by having hours in our grant that supports and funds their nursing program. Our students do rotations with them, and you can see from the picture here that they have an amazing time when they're out working with them. We've also have rotations with the breast cancer, cervical cancer screening program, with primary care telehealth, with school-based telehealth in our pediatric nursing program, with a Clara Gunn Rural Community Center, and also have added behavioral health telepsychiatry as an opportunity for our students to become involved. A second or third, I should say, grant that we have, the SET grant, the Simulation Education and Training Grant. Its title that we put was Integration of Telehealth into Practice, Enhancing Simulations to Improve Mental Health and Chronic Disease Management. And with this grant, we wrote this grant during the COVID pandemic. And at that time, what we were seeing clinically was many providers not understanding how to use telehealth, and definitely many consumers not understanding how to use telehealth. And so we put a focus on telehealth, mental health, and chronic disease management. And we wrote this grant in 2020. It was 2 years later when HRSA called us and said, "You wrote this proposal, you got a score of 100. We didn't have the money allocated to fund you. Can you do it now?" So I encourage you to not throw away anything that you've written. Many times you can reincorporate something for a revision into another grant, and at the same time, realize that you might get funded later. So 2 years later, we had to look at our goals and objectives and do a little bit of tweaking. and get HRSA's approval, but we then were awarded in 2022. And this was only a 2-year grant. We will be finishing it up in August. But really, this has worked on increasing our simulation scenarios to focus and address the telehealth, mental health, and chronic disease management. We've also strengthened our partnerships with agencies doing telehealth so that our students have increased experiences. And this really will foster our students graduating with actual competencies in telehealth, that when they go to their new employer, they'll be able to say, yes, I've had experience in this. And we're currently working on a process of them actually earning badges that are related to telehealth as well. To go back and say a word about our grant that we wrote for the mobile health clinic and focus on getting into the community, we actually repurposed a previous proposal that we had written for AACN, and were able to then put it within the context of HRSA's requirements and be able to reutilize some of the work that we had written earlier. So just wanted to reinforce that aspect. Next slide, please. A large part of what we are doing is actually charting a path toward health equity, collaborating with our rural communities, really assessing strengths and needs of the population, identifying and confronting social determinants of health, and having our students be educated in that arena. Engaging with residents in the community with mental health needs. And not only is it that our students are learning telehealth technology, they're actually able to teach it. And we actually have workshops that we present in the community to help residents be able to access their electronic health record and to be able to navigate within it. And we even were able to get our local health system to create instructions in Spanish. The EHR and how they could access MyChart is not in Spanish currently, and I know that's something that EPIC, that program, is looking toward, but at least giving instructions that were in Spanish so that the people in the community would have easier pace at navigating was an outcome of this grant. We also have integrated telehealth throughout our DNP program, with them having simulations on acute care, musculoskeletal clinic visits, to chronic disease management and follow-up. We've been doing sessions on telehealth aimed at older adults and under-resourced communities. We've done a lot with our mental health, telehealth, and community-based simulations and implementing reflective practice with our students. And we've also created reliable and measurable tools for learning effectiveness. And as a part of many HRSA grants, they will say that what you create as a part of the grant, you then have to be willing to share. So with this grant, we are creating a repository where those simulations that were created and all of the tools that we've utilized will be available for others to use. So by fall, that will be up on our website. So I'll pass to Dr. Williams and let her share with you about her grant.
Good afternoon, everyone, and thank you for having me here today as well. I want to emphasize one of the key things that Dr. Snyder said. It is a good idea, once you write a grant, don't give up on it. The new grant, I was very fortunate when I was at another university. I did write the Renew grant and work on it and got it scored and funded for the funding to be unavailable that year. So when I came to UNCG, I took a lot of the bones of that grant, and you have to make it specific for your university, your community, and the data there. So it's not like you're rewriting the whole thing. So it is important that you do maintain your grants, maintain whatever you write, and use it based on your area you're at now. Their new grant, the main purpose for the new grant is to increase the number of primary care nurse practitioners. And for our school, that's looking at adult general nurse practitioners and family nurse practitioners. Now, this also could be midwives or maternal mental health and substance abuse. But for our program, we only have FNPs and adult generals. And so the money from the grant is used to support the training and graduates of our students in our advanced programs. And this grant was unique in that 90% of the amount for this grant had to go towards the students, because every grant is different, and some grant allow more staff support, more things related to the faculty. But this particular grant, you had to put majority of it towards the student. And so this grant is very fortunate for the students, because this was a $2.5 million grant, and each student who applies and accepted that meet the requirements can get up to $25,000 towards that education to be a nurse practitioner and agree to work in a underserved area within North Carolina. Applicants are, and we have to, again, when you're looking at the grant, you have to really focus on what the aim and the purpose of the grant is. And this grant really encouraged that the students who got the grant or traineeship we focus on diversity, not just of the students, but also of the faculty as well.
So, Dr. Williams, before I move to your next slide, I want to make sure we heard you correctly. You wrote a similar grant at another institution. It was scored. They said they were going to fund you, and then they didn't.
Yes, They said, congratulations, we have recommended you for funding, but unfortunately we don't have the funds. And so when I came here, I took the meat of that grant and readapted it for this area, because each area, each state, each region gonna be a little different. And Audrey made a key point too. She talked about the innovation. And I think one of the reasons I got this innovation as a minority person myself, I recognize that there are other things that will prevent a person, especially a person of minority, from achieving a higher degree. And it may not always be tuition. So my grant, I put in information or put in specific things that looked at other obstacles that could prevent a person from receiving a higher degree other than tuition, such as transportation, childcare, other maybe they need more academic support like tutoring. So there's other things to make it more innovative and appealing other than just trying to meet the need of tuition. And so this is just the summary of the strength of the grant. When you get it back, they give you the strength and why it was awarded. And so it clearly described the needs to increase the diversity of primary care providers within the region. And again, I had to show data for our area, the Triad area, to look at the number of primary care providers or lack of primary care providers, and to show that by providing us with the funds to increase the number of nurse practitioners, we can meet the needs of this area by increasing the number of providers, especially diverse providers. The application thoroughly outlined the workforce need to address chronic health conditions, social determinants of health, and health disparities within the target population. And as you can see through Dr. Snyder's presentation, social determinant of health and meeting those health disparities is a key part of a lot of the Herschel grants, especially trying to meet the workforce needs and the needs of the community. The application provided charts, demographic data, and narrative description of the target areas that clearly demonstrate the purpose of the program. One of the things about Herschel grants, other people read these grants other than healthcare people. And so your write-up, I use a lot of charts and graphs in mine. I'm sorry. So I use a lot of charts and graphs, and I think a table clearly outlines a lot of information that you may not see sometimes in a written summation, because again, sometimes people are assigned to read, they have a lot of grants to read. So the clearer you present the information, the better picture you can paint on how you are the best agency to get this grant, or the best person to get this grant is very important. So making sure your charts, your information is clearly presented. And so sometimes sometimes it's better to use tables and graphs versus summations or word information. Next slide. So the key thing, the recommendation I would point out is that make sure that your information you're using, like I said, I had to take the update this grant to be more pertinent to the Triad area. Now I'm in North Carolina. So make sure you use accurate and current data. You do need to have community support and partners. Know your population, know what your needs of your community is, because you have to write that, clearly explain it in your grant. And your faculty expertise, because it's not just you who's doing the grant. And so do you have the faculty? This grant was a workforce grant, and so I had to describe my faculty. Do I have the faculty to train new nurse practitioners? How am I maintaining their skill level? And also I had to include information about my preceptors. And so again, looking at your preceptors, your community partners, your agency partners, and you have to get support letters from them saying they will support you, that they will allow you to come into their work sites, their offices and clinics in order to provide the necessary training for these new nurse practitioners. So though all those things are important. So making sure you have all that data and information. I can't emphasize enough the importance of good letters of support that shows that you have the infrastructure and the processes needed to support the students and support the grant and meet the needs outlined in the proposal, the grant itself, the goals that the grant originally puts out. And make sure that you have the resources and support at your institution as well. And a lot of times, again, that comes back down to your faculty. Do you have the someone who's going to actually look at the budget for you and make sure all those things line up? So it is important to make sure, because again, that's part of your write-up of the grant, and then looking at how well you wrote your budget, who's going to oversee that information, and how that's going to align with the how the money is going to be allocated and used.
Okay, so now we're going to enter into a question and answer period. But before we do that, I just want to share a few tips too. When you get that announcement, when they send out that call for the grant, make sure that you read it thoroughly. In fact, I would suggest that you turn it into an outline. If you turn it into an outline, you will make sure that you can see all the parts that you need to include, and also be sure that you look at the evaluation criteria. They tell you how they're going to evaluate it. So make sure you address all of that. And if there is a priority area, then make sure that you, to the extent possible, address that priority, because that will help to boost your score a little bit. One thing I have found that used to kind of annoy me a little bit when I was reviewing, if you need external support letters, then, and it is a good idea for you to help draft those, particularly if you're working with agencies that don't do this kind of work all the time. It is important that you draft the letters, but don't make them all sound the same and look the same. Make them specific to the entity that is partnering with you. So for this next part, I'm going to ask Dr. Snyder, Audrey, and Wanda a few questions, and then we will save some time for you to ask your specific questions of any of us. So the first question is, how do you know about this funding? How do you find out about it? Either one of you. You're muted, Audrey.
My apologies. You can go to the HRSA page. You can create an account, and you will get loaded in your mailbox many calls when they are there. But you can also just go to the HRSA page, and you can search for what the recent grants are. They usually come up in a list by the ones that are due the soonest. Also, if you've ever written a HRSA grant, usually the PI will keep you informed of future funding. I had a meeting last week with the PI of one of my grants. I'm sorry, I'm saying PI, but PD, the project director from HRSA, and they said, this grant that you have will be coming up again in the fall. So there will be an opportunity for you to reapply for this proposal.
Yeah. Yeah, and I echo the same thing. And your program director, they're very good about keeping you informed and working with you through your grant as well. And it's important that you're doing your own searches on occasion to find out what's out there and what's coming up.
Yeah, and I have elected to sign up to get the notices, so I get all the notices as well. So what's your approach to writing a HRSA grant? How do you prepare to write?
Well, one of the first things I do when I get the proposal, as Dean Barksdale said, is to go through it and to read it. And I create that outline, but when I create the outline, all of the evaluation criteria, I fill in under each category. So they tend to separate it. And so they tell you what they want, and the evaluation criteria is at the end of the request for proposals. And I then cut and paste and move it up. I create the outline. I also create a list of requirements by pages. And today, writing a HRSA grant, you do not have the ability to be verbose because there are page limits on everything. So you have to be able to be succinct. So I create a list of each of the documents, how many pages it can be. And if I'm thinking about who I need to write letters, I start putting those in my list. And then the next piece is to pull together a team, is to put it out to the faculty and to ask for the group that would be potentially doing this work to come together and to have a brainstorming session. And I do a brief overview of the grant call, and then we write all over a board about what their ideas are or what we might be able to do. And that's the beginning part for me. Then we go back and create a little bit of structure and create the objectives and present that to the dean to say, is this what, is what we're thinking in alignment with how you feel the direction of the school is going and what we need to support our students and our faculty and our programs within the school.
Listen, and the same. I thoroughly read the grant. I actually have different color highlighters. I do different. I highlight key points. Focus in on what the priorities are. And again, like Audrey said, you got to look at the evaluation outcome as well for those different priorities. Because one is in one area of the document, the other one's going to be toward the end or maybe in the middle. But you got to pull all those pieces together. And I think that's what is a hindrance to some people sometimes. They just read maybe the initial call and don't really thoroughly read all the every detail and every process that's involved in that grant. And then when you pull your team together, assign people to do different things. Because again, data is important. So maybe you want to have someone to look at the data for the community, and maybe someone look at the faculty if is looking at the faculty issues. So you want to have different people assigned to do different things, so you're not doing everything yourself, and then get together and pull everything back together. And clear and concise. I can't emphasize enough. The clearer and the concise, the better, because you do have limitation on your pages, and you don't want it too worded where they don't understand what you're really trying to get to. What's your point?
Okay. And they usually don't give you a whole lot of time to prepare this, right? So I suggest that if people have a good idea, even if there's not a funding mechanism for that good idea right now, that you start thinking about it, start working with your team, start brainstorming, so that when that funding announcement comes, you're ready to act on it. You might have to tweak some things, but have a good idea in mind already. Next question. What are some of the common elements that you find across HRSA grants? And Audrey, you have 3 or 4 of them right now. And so can you tell us what some of those are? And also if you and Dr. Williams collaborated on any of the common elements.
So every grant, you're going to have to spell out what your resources are. Your resources from your institution, from your School of Nursing, in your community, or who your community partners are. And it's just good. And if you have an Office of Sponsored Programs or a research office within your School of Nursing, they may already have some of that information, but it needs to be current and accurate. So it's really important. One thing that HRSA does not want you to do is to put in links to other information. So you need to have it spelled out right in your document, not give them an underlined link for them to go somewhere else. And yes, when Dr. Williams was writing hers, I shared information with her. Another piece is that I didn't mention under preparing was to do a timeline of what you need to get done in a certain time in the timeline. And a piece of that is to try and allow time for other people to review your document for you. so that you can get some feedback. Because if you're writing, or you're pulling together 3 people's work together into one document, there may be some places where there's repetition. There may be a need for transition and flow. But your institutional resources, your facilities, your budget is kind of common. And if you do have a research office that has personnel that can help you with working on the budget, that's really helpful. You'll have to fill in the pieces on the justification, but you also want to ensure that your budget has an opportunity for building in, even if your institution will not get a faculty raise, but you want to build that in just in case there's raises in the time period that you have the grant as well.
Okay.
Your letters of support is another piece. So, you're going to need support letters. So, you can draft those and have those ready to go.
Okay. Wanda, anything you
No,
want to add?
no, she pretty much covers it. Again, because there's a lot of things, your information about your institution, that's going to be the same in all your grants. So you can use that information and translate it to other grants. So there's key elements that if you do have an office of sources, I can't even talk today, they should have the information for you. So a lot of this stuff can be reused, and then you have to tweak it for particularly for that grant.
Mm-hmm. And I want to say too, if you don't have an office of sponsored research or some in your school or at your university that's keeping track of that, some of this information is the same kind of information you put in your accreditation reports when you describe your resources and your facilities and the library and your labs or whatever. So don't think that you don't have anything. You probably do have some things to start with. So how do you go about sharing information? And we heard from Audrey about how she shares when there's a grant call, how she rallies people together. So how do you go about getting buy-in from others that you work with in terms of what it is that you want to do with your specific grants? And after they're funded, how do you go about keeping everybody in the loop about what's going on? Either of you.
Well, we have meetings. When you pull your team together, that those group of people stay your team. So you do have monthly or weekly, depending on the grant, how you do meet with your team on a regular basis. You pull in faculty that got similar interests. And again, with this grant, with the workforce grant, I have to deal with all the faculty to deal with the nurse practitioner students. Email, and we're looking at hopefully in your area, you also do like many research updates and things of what's going on in your facility, in your school, and with because that helps motivate other students. We do notifications at our faculty assembly meetings or org meetings where we let all faculty know when we're doing what our grants are and what's going on to motivate other faculty to want to do the same.
Okay. Audrey, anything you want to share?
I think, faculty have amazing ideas. And what I find is when you put them together in a room, they'll come up with more ideas than you can even write grants for. So, having just really building on that, and then talk about what roles will be on the grant and what support there will be. And for many of our faculty, they're able to get some summer support to do some of the work by writing them into the grant for that support. And that, adds to that buy-in of let's work on this, let's make it happen together.
Yeah. And Audrey, can you talk about how your funding, some of the HRSA funding, has led to other funding opportunities?
So we, by some of our work, especially with our when we present about the work that we're doing into the community, we've been able to get foundation grants that has helped support our work in an elementary school. We've been able to apply for recently funding that would support more of a focus on cancer screening in the rural community with a foundation grant. Also, a grant that would allow us to again, focus on rural, but to help increase screening, especially for populations that may be averse to visiting healthcare providers. And so with this proposal, we're hoping to be able to do some focus groups to and be able to do some targeted messaging that would focus on how we could convince that population to maybe come for their screenings, and then to have opportunities for those screenings to occur where it's more convenient for them.
Okay. All righty. So now I'd like to open this up to others on this call to see what questions you have for any of us. I'm trying to figure out how to stop sharing, and I'm not being, oh, there
Before
it
you
is.
stop sharing, Dean Barksdale, will you,
Whoops, I got a couple more slides, don't I?
yes,
Sorry about that. Campus resources. You want to talk about that?
I think we've kind of covered that piece, but when I've moved institutions, I've always made an in-person appointment with the Office of Sponsored Programs, because I want to know who the people are if they're submitting the grant for me, and to understand how they operate and how they work and what their deadlines are. And for us here, it's usually 2 weeks ahead of time. I have to have everything ready for them to review. But another piece of getting your data together ahead of time is working with your Office of Institutional Research or Student Financial Services to have data on your students, and to really know what the cost is for students to participate in your program. There is one slide that does have some resources for you just to remember.
Yeah, well, so in summary, sign up to receive those notifications, review the RFPs, and begin to formulate your ideas. Know your community, know your community. So you're writing about your community. Address funding priorities and preferences if they're included. Engage your partners early, and include your grant management office, or sometimes even financial aid. We give scholarships, so we have to involve financial aid and others in the process. So here's a slide. I think they will be available to you, some resources at HRSA. And time for your questions. And thank you. And I'm going to stop sharing.
Dr. Barksdale and Snyder. So a point was just made. Dr. Snyder, you made it right before Deborah covered the last few slides, where you said to work with maybe your registrar's office and get data on your students. And then you said, and the cost of, I think, their education. Can you say more about what data that your peers in other schools should collect from their registrar's office?
So you do want to know, based upon which program you're writing a proposal for, that the number of students and their minority status, first-gen college students, anything that shows that you're working with a group that may be under-resourced, where that this program and these scholarships that may be able to be offered through your program will support. And so that's data you can request in advance and have readily available to share.
Thank you. And now I open the floor to others. Deborah, I'll let you take it over.
Okay, so if you want to use the little raised hand icon, because I cannot see across both screens. So if you want to do that, that would be very helpful.
And I could also help you, if more than one hand is raised, I can help you navigate that.
Okay.
So while we are waiting for others to raise their hands, so one of the reasons why Jasmine and I asked you, Dr. Barksdale, to do help your peers across the country on applying for HRSA grants was that we had heard from a couple of smaller education institutions saying that they were told, similarly to what Dr. Williams was told when they applied for a grant, that from HRSA, that they were accepted but not funded. And they assumed that they were not funded because their their schools, their programs were so small. And you, as a former reviewer for HRSA grants, seem to have some insights there. Can you share those insights, please?
Yeah, so what I found, and this can be frustrating sometimes, you will have someone, institution that is a grant writing machine, and they can take the most minuscule little idea and write it so well, and it's so compelling. I have literally seen people break down in the reviews. When we used to meet face to face, they would break down because we would have an institution that had a better idea, but it wasn't well written because they weren't as prepared, to write a HRSA grant, and that breaks your heart. And that's why we're stressing so much here today. Make sure you read the call. Make sure you know what they're asking for, and make sure that you address all of that, and have someone else read your proposal, because they can help you, like Audrey said, with flow and gaps, and does it make sense? Is it logical? Did it address all the things? And that is critically important, because I don't believe anybody is making decisions based on the size of a school or the size of a program. It's writing that's how you present yourself, and that's what they're looking at. Wanda, I see you have a comment.
Yeah, I want to add to that. You can always, if you submit your grant proposal and it comes back, either not funded or not funded, you can always reach out to the program director for some little more specifics on, what can I do the next time to improve. And with my grant, when I was at the other university, when I reached out to them, that particular year, it was right after COVID, and they was originally supposed to fund 50, and because of the budget cuts, they only funded 20, and I was at 22. So it's like, so that was even worse to find that out. But so sometimes it's not because you're a smaller institution. They do have a number of how many they're going to fund, and they rank them. And so sometimes finding that information out. And like Audrey said, she had one that was funded, that didn't get funded, but they reached out to her and said, now you can resubmit it. It's interesting. So, so you want to keep those things in mind as well.
Anyone else have any questions?
I'm wondering if Jasmine is still on. She might have needed to drop off. She might have been boarding her plane. Oh, she might be still on. Anyway, if she's on and can hear, if she had anything to share, I just thought I'd give her that space, since she does so much work with all of you.
Mm-hmm. I see Dr. DeWitty just came on.
I think
No, I've been here all the while. I think I must have been on your second screen. I heard your entire presentation, and I'd like to thank you all for taking the time to share all your pearls of wisdom with all the schools. I'm sure that you all know that there will be the summit in September, and all the schools that serve underrepresented students, HBCUs, HSIs, and American Indian Native Alaskan schools are being invited to participate. And throughout the past several years, funding has been one of the barriers that has been identified, and many of the schools would like to know how to improve their chances of receiving funding. Some have applied, not been approved, not funded. And so it's great to hear your success stories and to learn to not give up so easily, but to stick around. So thank you for such an outstanding presentation. I really appreciate it.
Now, for the September meeting, what we're going to ask that participants do is to start to prepare some of those common elements. So start to gather those, start to write those. And if there is a call out by then that you're interested in, really start to take a look at that. because you can see what they are looking for, whether it's a logic model or the program outcomes, all of those things. And you got to just, if you haven't done this before, you just got to dip your toe in the water and do it. It's nerve-wracking, I can tell you, especially because it's usually not a whole lot of time to prepare it. But if you do it, at least the next, and even if you're not successful, you might be, but you'll have something for the next time that you can work on to refine. Now, I don't know if our HRSA colleagues are on this call, and if they are, even if they could address this, because we had heard that because it's an election year, there may not be as many until after it's decided. And I don't know if any of that is true or not. Like Audrey said, she heard that there is going to be at least one that we've heard of. But keep your eye out. So go sign up on the HRSA website to get the notifications. And you can choose which ones you want to get, or you will get like everything in the world. But choose what notifications you want to get, and then you'll be in the first to know when they release something.
Yeah. Deborah, I would like to ask a question of you and your faculty. I don't know how relevant this is, but I've always thought that if you have an idea, and Audrey, you made reference to this in terms of faculty having wonderful ideas. If you have an idea that you want to eventually grow into some kind of a funding opportunity, what are your thoughts and guidance about just drafting a concept paper about that, even if you just put it on your parking lot, and then when something comes about, you already have a concept that you've been thinking about and wanting to fund. And I've always thought that, this is something that's a passion for you, and here comes a funding opportunity. That's the match. Can you comment a little bit about that?
Well, I actually think that's an excellent idea, and that's what I was trying to allude to. Get your ideas together beforehand, because you never know. And if it's not HRSA, it might be something else. I mean, there are many more opportunities that are available, and you just have to find the match between what you want to do and who wants to pay for it. And sometimes it's HRSA, sometimes it's a foundation, sometimes it's a private donor or an insurance agency that has a what do you call it, corporate arm. So don't give up on your good ideas, and be ready and willing to pitch them. I've seen grants that they only wanted one page. So, and they'll give you a lot of money for one page. That means you got to have it tight and clear and know what it is that you want to do. I think for us, the major benefit, or one of the major benefits for having these HRSAs, is being able to help address student financial need, improve their education, and also in many cases, helping out and addressing the needs for the community.
Well, on that note, thank you. And Jasmine texted me. She had the connection she had was difficult, but she wanted to express her deep gratitude to our presenters. So thank you, Deborah, Dr. Barksdale, Dr. Williams, and Dr. Snyder for sharing your wisdom and knowledge in this area. It is, as has been underscored several times, one of the big needs of all of the schools that we engage on our mentoring support program. And to all, if you have not yet informed Jasmine and the team about who from your school is attending that 2-day workshop, please contact Jasmine, Geneva, or me about that. Because we want to make sure you're on our invitation list. And of course, we are paying for one representative per school. And if you wanted to bring another, we are asking the school to support that second person. So thank you. And thank you to all on this call for all that you do for patients and families each and every day. Take care. See you soon.